In a clinical trial of a new transcatheter aortic valve in which all the patients were undergoing routine four-dimensional volume-rendered CT scanning, investigators made an unexpected discovery. One of the patients who underwent transcatheter aortic valve replacement, or TAVR, subsequently had a stroke. The CT scan showed reduced aortic valve leaflet motion, suggesting possible subclinical leaflet thrombosis. This finding prompted important questions. How common is reduced aortic valve leaflet motion after TAVR or surgical aortic valve replacement with a bioprosthetic valve? And is there a difference if patients are on therapeutic anticoagulation? In this study, 187 patients who had recently undergone transcatheter or surgical aortic valve replacement underwent CT scanning. In addition, information on anticoagulation and transient ischemic attacks and strokes was collected. 55 of the patients were from the TAVR clinical trial, and 132 had recently undergone either transcatheter or surgical aortic valve replacement with a bioprosthetic valve and were recruited from 2 registries for this study. Reduced leaflet motion was noted in 40% of the TAVR clinical trial patients and in 13% of the registry patients, who received a variety of valves and whose CT was performed at various time intervals. In both groups, the incidence of reduced leaflet motion was lower with warfarin than with dual antiplatelet therapy. There was a significantly higher incidence of TIA or stroke in patients with reduced leaflet motion from the registries, but not in those in the TAVR clinical trial. The authors conclude that there is reduced aortic valve leaflet motion in patients with bioprosthetic valves, and that this can be resolved with therapeutic anticoagulation. Full results are available at nejm.org.